Good morning, teacher and students. My name is Jennifer Almeida, and I'm going to talk about catheter ablation of ventricular arrhythmias. First, we have definition. Ventricular arrhythmias. When an abnormal heart rhythm comes from the lower chambers of your heart, it is called a ventricular arrhythmia. Rhythms of this type include ventricular tachycardia and ventricular fibrillation. Heart beats too fast, which prevents oxygen-rich blood from circulating to the brain and body, and may result in cardiac arrest. Catheter ablation is a minimally invasive procedure in which the doctor advances a flexible tube catheter throughout the blood vessels to your heart to ablate, stop abnormal electrical pathways in the heart tissues.
Depending on activity level, the heart beats about 60 to 100 times per minute. It may be higher during exercise or lower at rest. A normal heart rate and rhythm ensures the delivery of oxygen-rich blood to all of the body's organs, such as the brain and lungs. A group of cells in the heart, called the cardiac conduction system, uses electrical impulses to control the speed and rhythm of each heartbeat. An abnormal heart rate or rhythm, called an arrhythmia, occurs when there's a problem with the heart's conduction system. Tachycardia is a type of arrhythmia where the heart beats too fast. Fibrillation is a type of arrhythmia where the heart beats irregularly and may be too fast. For certain types of arrhythmias, a catheter ablation procedure may be necessary to stop the heart tissue from causing the arrhythmia. After numbing a small area in the groin with a needle, the doctor will insert a short hollow tube called a catheter sheath into the femoral vein. Next, a long flexible tube called a catheter will be inserted through the sheath. The doctor will guide the catheter to the heart through a blood vessel that goes to the heart, called the inferior vena cava. The location and progress of the catheter will be monitored. When the catheter reaches the heart, the doctor will guide it to the area that is causing the arrhythmia. The doctor will find the problem areas using a 3D map of the electrical activity of the patient's heart. The tip of the catheter will emit either hot energy or cold energy to ablate the tissue in this area. Ablation makes the treated area stop working. For an atrial arrhythmia, a doctor will ablate the atrial tissue causing it. If the affected tissues are small, well-defined areas, the procedure is called focal ablation. Or if the affected tissues are larger areas with more complex rhythm disturbances, the doctor may perform a procedure called ablation remodeling. Both types of ablation restore normal electrical impulses and prevent an arrhythmia from happening. If the cause of the arrhythmia is in the ventricle, the doctor can do either focal ablation or ablation remodeling to treat more complex arrhythmias of the ventricle.
Applications in medicine. Catheter ablation has emerged as an important and effective treatment option for many recurrent ventricular arrhythmias. It is a procedure where areas of the heart are electrically inactivated or ablated to resolve an abnormal heart rhythm.
I'm Dr. Kevin Thomas, a cardiac electrophysiologist with the Norton Heart and Vascular Institute. The heart's electrical system produces signals that control the timing of your heartbeats. Sometimes, this system can beat irregularly and cause symptoms of palpitations, rapid heartbeats, or skipped heartbeats. This can be due to short circuits in the electrical system, extra heartbeats, or abnormal electrical connections. These abnormal rhythms are called arrhythmias. Oftentimes, these are not dangerous, but they can become serious when they affect the heart's ability to pump blood or if they are due to another underlying heart condition. Treatment of arrhythmias may include medications or a procedure called catheter ablation. A catheter ablation is a minimally invasive procedure to correct an arrhythmia. Catheter ablation can be performed to diagnose and treat a wide variety of arrhythmias, including supraventricular tachycardia, also known as SVT, atrial fibrillation, atrial flutter, ventricular tachycardia, and premature ventricular contractions, also known as PVCs. The catheter ablation procedure is performed in the electrophysiology laboratory of the hospital, where you will be placed on an X-ray table. You may be given medications intravenously to sedate you or make you sleepy. These medications help reduce your anxiety and relieve your discomfort. Your groins will be cleaned with antiseptic, and sterile drapes will be placed to cover your body. A local anesthetic will be administered with a tiny needle to numb the area where the catheters are inserted. You will feel a pinprick and possibly a stinging sensation for a few seconds. Small, thin wire electrodes will then be placed through a vein in the groin. These catheters will be guided to your heart using a special type of X-ray called fluoroscopy. Once in the heart, the electrodes measure the heart's electrical signals and are used to stimulate the heart from various locations to try to induce or start up the abnormal rhythm. Medications are sometimes used to assist in stimulating your arrhythmia. Special software is then used to make a 3D map of your heart and its electrical system to help your physician pinpoint the abnormal tissue in your heart. The catheters are then used to burn or freeze these small areas of heart tissue that generate and conduct the abnormal electrical activity. Upon the completion of the catheter ablation, the catheters are removed from your groin and pressure is applied to stop any bleeding. Following your catheter ablation, you will be moved to a recovery area to rest quietly for several hours. Your heartbeat and blood pressure will be monitored continuously to check for complications. Often, patients are able to go home the same day, but your physician may elect to keep you overnight for monitoring. Be sure to review pre- and post documents on what to do before and after the procedure. As always, if you have questions, please reach out to your doctor's office. Thank you for choosing Norton Heart and Vascular Institute.
Now we have pros and cons. In the case of pros, higher success rate on average. Ablation has a 70 to 80% success rate, low risk of complications, fewer than 5% of patients develop any problems. Quick recovery. It provides improvement in the quality of life. Advances in catheter technology, imaging, and mapping techniques have improved success rates for ablation. Cons. Repeat procedures for 20 to 30% of patients. The first ablation doesn't work and they have to go back for another. Sometimes medication is still needed. Ablation can sometimes even cause new arrhythmias. Ablation close to a coronary artery poses a risk of acute coronary occlusion and should be avoided.
Hi, I'm Dr. Richard Hongo, and I'm a cardiac electrophysiologist. Today we're here at California Pacific Medical Center, which is in San Francisco. This is one of our dedicated electrophysiology labs where we're very fortunate to have cutting-edge technology that allows us to perform complex catheter ablation procedures such as ventricular tachycardia ablation. Now, as you may know, cardiac electrophysiology is a subspecialty of cardiology that deals with all different types of heart rhythm problems. Ventricular tachycardia is one of those problems, and it is very important primarily because it can be life-threatening. Now, there are many therapies out there for ventricular tachycardia. Some of them include medications that suppress the heart rhythm problem. Others include implantable devices such as defibrillators, which then monitor and at times need to shock patients out of the rhythm into sinus rhythm or normal rhythm. Ventricular tachycardia ablation is all about finding the spot or the short circuit that is causing the rhythm disturbance. And using catheter-based technology, we find and eliminate the cause. Here at California Pacific Medical Center, we have our anesthesiologists sedate our patients very comfortably at the onset of the procedure. And through a small incision that I make at the groin site, I place sheaths into the veins, and you can see me putting in catheters here. Then we push soft insulated wires or catheters through the large central veins, and you can see the catheters now floating up through the inferior vena cava. And we can also utilize the stereotaxis remote navigation system to move catheters inside of the heart. There are several advantages of using this newer system. One of them is the catheters are very soft. You can see me pushing the catheter now up against my hand, and it buckles very easily. This virtually eliminates the risk of catheters causing any unwanted injury to the heart wall. Also, in addition to this, using these large earth magnets that are housed in these retractable towers, and in this image you can see the towers being pulled in on either side of the patient. The magnets then move the magnetized catheter with millimeter precision to really all corners of the heart just through computerized controls. And you can see us now dragging the arrow icon on the screen and moving the catheter in this way. In a very controlled environment, we start up and stop the ventricular tachycardia using pacing and intravenous medications, and we start visualizing where the tachycardia is actually coming from. Here is a reconstructed 3D virtual image of the inside of the right ventricle in a patient with ventricular tachycardia. The earliest electrical activation is seen here on this map and shown by red. So let me explain catheter ablation in a little more detail. If this here, my hand, is the wall of the heart, the ablation itself is caused when the tissue underneath the tip of the platinum catheter electrode is heated to somewhere between 50 to 60 degrees Celsius. Now this in and of itself is not very hot, but when kept on one spot long enough, somewhere between 30 to 60 seconds at a time, that's enough to cause some denaturing right below the tip of the catheter itself. And this denatured tissue stops all electrical conduction. And over a few months' time, this denatured tissue then heals itself into some permanent scar. And this is what keeps ventricular tachycardia from reoccurring. So in summary, catheter ablation for the treatment of ventricular tachycardia is a procedure that really relies on us being able to precisely localize where the site of tachycardia is actually coming from. It is through real advances in technology that we've been able to now perform this procedure not only effectively, but safely, such as the use of 3D imaging, where we're able to visualize where that spot is actually coming from, or the use of magnetic remote navigation, where we're able to move catheters safely as well as precisely within the ventricle. Catheter ablation is an emerging tool in the treatment of ventricular tachycardia, and alongside other therapies such as medications or implantable cardioverter defibrillators, it should be a treatment that is considered anytime you're dealing with ventricular tachycardia. I'm Dr. Richard Hongo, and now you know.
Issue apply in Ecuador. There are only a few health facilities in Ecuador that, after this procedure, however, it has been possible to notice improvements in patients. In Guayaquil, the cost of cardiac ablation goes around $30,000. And finally, we have the conclusion. Catheter ablation is the best option for patients that have ventricular arrhythmias. Risks are low, and the percentage that the procedure will be successful is really high. And that's all. Thank you for watching the video.